Assalamualaikum and good day. My name is Putri Ifaiudina. I'm from the Bachelor of Medical Imaging Cohort 12A from KPJ University Healthcare College. And today I'll be presenting to you guys about the hysterosalpingography, or we known as HSG. So let's look into our table of content for today. First, we're going to look into the introduction, which shows the anatomy and also the indication. Next, we're going to be looking into the procedure. We're going to be looking into the patient details, the preparation before the examination, the procedure and also the post-procedure, the patient care during and after the procedure, and lastly, what radiation protection applied here. And then we're going to be looking into the image analysis, and lastly, we're going to be looking at the conclusion that shows the diagnosis and also the reference used in this presentation. So first, let us look into the female reproductive system anatomy. So the main organ in the reproductive system, female reproductive system, is we have the fallopian tube, and then we have the uterus. We also have the endometrium wall. We have the cervix. We have the cervical canal, and also we have the vagina. These are the most important organs in our reproductive system. Then let's look into the anatomy in HSG. So as you can see, this is a normal HSG image, where you can see the contrast media will enhance the anatomy for further diagnosis. So you can see here is the uterus with the contrast media injected. We have the right fallopian tube, we have the left fallopian tube, and you can see there is spill of dye on the left and the right side of the fallopian tube of the peritoneal cavity. So when there's a spill of dye on the left and the right side, which means the fallopian tube is not blocked. Now let's look into the indication. Why do we do HSG examination? Is that if there are any abnormal bleeding or spotting between the menstrual period, or they have a habitual spontaneous abortion, or they have any anomaly, or the loss of the intrauterine device IUD, or there will be a patency in the tube. So these are all the indications that has to do with HSG procedure. So the procedure, before we going to perform an HSG to the patient, we need to know the patient details. So what are the patient details that we need to know? First is we're going to need to know about the pregnancy. Does the patient pregnant? And then we need to know if the patient have any allergies or adverse reaction to the past medication or others iodinated contrast materials. We need to know the patient last period cycle. We need to know if the patient have allergies to latex, and lastly, if the patient have taken any medication. These are the important details that we need to record before we perform an HSG to the patient. So let's look into patient preparation before we perform. After we get the patient details, we need to prepare the patient. So first, we must have the patient to have a proper bowel preparation. This is important to ensure the adequate visualization of the reproductive tract. And then the patient is allowed to take any mild laxative before the examination in order to clear the bowel. And then the patient will also instructed to take any mild pain reliever. This is to ensure that the patient will have less pain and discomfort during the examination. The patient also will ask to instruct to empty the bladder before the examination. And if the procedure cause complication or any reaction, you need to explain to the patient so that the patient know what they are going through. And then lastly, we need to obtain the informed consent from the patient in order for us to perform HSG. So let's look into the equipment used in HSG. Of course, you have the vaginal speculum, which is this one. This is the vaginal speculum, the sterile gauze, sterile drape, the Leach Dickinson cannula. We have the sponge holding forceps, 10mm syringe, the lubricant jelly, and also the extension tube. So this is the equipment that is in the HSG tray that we can use to perform this examination. So let us dive into the HSG procedure. So the first is the antispasmodic is given to the patient before the procedure, and then we take the scalp film, and then the patient will be placed in the lithotomy position, and the perineum will be cleaned with the antiseptic solution and is draped with the sterile towel, and then the cervix will be localized and cleansed with the povidone iodine solution, and we will lubricate the vaginal speculum and it is inserted into the vagina. Moving on. After that, the cervix will be cannulated with the leech Wilkinson cannula, and then the tenaculum is used to hold the interior lips of the cervix. Then the speculum will be removed and the patient will be placed in a slight Trendelenburg position and will be slowly injected with the contrast. And when the contrast media is injected, it is injected in 3 ml of contrast media is injected into the urine cavity and another 3 ml of the tube, up the tube. So it will be up to 10 ml of the contrast media. And then we will take 4 spot film. And lastly, if we necessary, we'll take an additional oblique views to visualization of the pelvic pathology and the tortuous fallopian tube. So here is the 4 spot film that we took. First, we will take the film, the radiograph, when there is an early filling phase of the contrast media, and then when the uterus is fully distended, which is the contrast media is fully in the uterus, and then the tubal filling phase, and also the peritoneal spillage, which is when the contrast media spill from the fallopian tube. So, after the procedure, let's look into the patient care and the radiation protection we use on the patient. So, for the patient care, we have during the procedure and after the procedure. So, during the procedure, make sure to use the perfect amount of lubricant on the vaginal speculum so the patient will feel less discomfort and less pain. And it's always important to tell the patient what is the next step, so the patient will be always ready for our next step of the procedure. And when the patient shows the feeling of pain, make sure to ask her to take a deep breath and say that everything is going to be fine, it will be end as fast as possible. And then do not inject all the 10 ml contrast media in one shot. The contrast media need to be injected slowly. And lastly, ensure the patient is in comfort position. Before you undergo the procedure, ask the patient if she is in a good position. Does she want to change the position to a more comfortable one? You need to ask the patient. And then after the procedure, we need to take care of the patient. Tell the patient that it is normal to have a spotting or bleeding after the examination. And it is important also to tell the patient that she can take pain reliever. It's okay to take the pain reliever if she can't withstand the pain after the procedure. We must advise the patient do not use tampon, dope, or avoid any sexual intercourse for the 24 hours after the exam. And if the patient have a fever after the exam, notify her that she needs to inform the physician immediately. So, lastly, what is the radiation protection that we use for this HSG procedure? Is that first we use the thyroid shielding, and also we use the gonad shielding. This is thyroid shielding, and this is the gonad shield. So let's look into the image analysis when we get this picture. So a normal HSG analysis. So you can see from the picture, we can see the uterine cavity show as a triangular contrast field structure. The triangular contrast field structure with base on top and the apex caudally, which is the inverted triangle. And then we can see the uterine fundus on top, which can be flattened, concave or slightly convex. And then we can see a free spillage of the contrast to the peritoneal cavity. This is the spillage of the contrast to the peritoneal cavity, which induces the fallopian tube is open. So for the conclusion, we're going to be looking into a few diagnoses, image diagnoses from the HSG procedure. The first is Didelphys uterus, which is this picture number 1. This is a condition where there's a complete duplication of the uterus, cervix, and vagina. As you can see in the picture, we can see there's two uterine body and there's two cervix and two uterine body. And there will be no normal uterine. That is called the Didelphys uterus. And for number 2, we have the unicornuate uterus, which is the elongation of the uterine cavity and has a single fallopian tube. So as you can see, we only have a single spill of the contrast media, and there's the elongation of the uterine cavity. Diagnosis number 3 is that submucous leiomyoma of the uterus. So this is a it's a particular type of a fibroid that develops in the inner layer of the uterus or in the submucosal layer that attach a long stalk. So as they grow, the submucous fibroids can block and distort the fallopian tubes. So it making it impossible for the sperm to travel into the uterus for the implantation. Next, we have the Asherman syndrome. So what is an Asherman syndrome? Asherman syndrome is an acquired condition. Either you are not born with it. That refers to having a scar tissue in the uterus or at the cervix. So this scar tissue will make the wall of this organ stud, as you can see from this picture, stick together and reduce the size of the uterus. As you can see here, the organs are stuck together and the size of the uterus is also decreased. Next, we have the unilateral cornual block. So, as you can see from this picture, there's a normal left fallopian tube here, and there's with the free peritoneal spill, while the right fallopian tube is not outlined. There is no peritoneal spill on the right side of the picture, while there's a peritoneal spill on the left side of the picture. So the uterine cavity is not normal and this is a primary infertility. And lastly, we have the hydrosalpingo, which is this shows the left hydrosalpingo on the HSG. So hydrosalpingo is a blockage of the woman's fallopian tube that caused by a fluid buildup and dilation of the tube at its end. So as you can see here, on the left fallopian tube, there's a blockage. So there's no spill of dye at the peritoneal cavity. So this is all the reference that I've used to make this presentation. Thank you for listening. Have a good day.